I had been experiencing an unremitting series of bladder infections for almost a year, and I was feeling really uncomfortable and was not responding to the medications that were being offered to me by an OBGYN, and I was feeling really frustrated. And finally, it was suggested that I go see a urologist.
When she first came to see me, she was having a lot of problems with what she thought was recurrent urinary tract infection. They were finding blood in her urine. She was having to go to the bathroom quite frequently and having pain with urination. And given that she'd had so many problems, we end up starting to look for more other reasons as to why people are having these infections. And in the clinic, I was able to look inside of her bladder, and I saw a small tumor growing inside of her bladder, or at least a mass that appeared to be like a bladder cancer.
He told me what was going to happen, and we tried a procedure and thought it had worked, and actually I had to go back a second time.
Unfortunately for Carol, we looked back in 3 months later and her tumor had recurred, which confirmed my concerns that this tumor was coming from the tube draining her kidney.
He checked again at several months later and wasn't totally happy and decided he wanted to do some reconstruction work. And I was glad. If we were going to do it, I wanted it to be right.
Whenever we're doing surgery for cancers like Carol's of the ureter, the goal for us is to try and save as much of her kidney as we possibly can. Well, her tumor was isolated just in the lower portion of her ureter, and I felt fairly confident if we would be able to just take that portion of the drainage tube out, I could save her the rest of her kidney and take her ureter and reimplant that into the bladder to allow her to keep her kidney.
When he did the reconstruction of the bladder, he was able to preserve the bladder enough of a percentage of it that I am fine, and I am very grateful for that. Very grateful.